Hope you and your family members are safe at home. Today I'm going to talk about very important topic which is seldom discussed. Social stigma. Yes, I'm going to talk about social stigma associated with COVID-19 pandemic. Let us first understand what is social stigma. Social stigma in the context of health is a negative association or a connotation between a person with disease or a group with certain characteristics such as ethnicity, socio-economic status, geographic location, physical, psychological or behavioral pattern. During outbreak, a person with disease or a group with certain characteristics are labeled, stereotyped, discriminated against or treated separately. Such treatment not only affect a person with disease, a group with certain characteristics, their family members or caretakers, but also affect a response to tackle the pandemic. In the context of COVID-19 pandemic, it has already provoked social stigma due to three primary reasons. First, a disease is novel and spreading across the globe very fast, affecting many lives. It has created a fear of unknown, fear of uncertainty. In this time, it is very easy to point others, associate our fears with others. With these three reasons, social stigma is influencing our response to tackle the pandemic. Social stigma is very harmful. It drives people hide their illness. It prevents people take immediate healthcare assistance. It discourages people follow preventive measures and adopt healthy behaviors. It disrupts social cohesion. It creates panic. It propels fear. Ultimately, it creates mental distress. As a psychologist, I strongly believe that in order to tackle this pandemic, we must address social stigma together. We can make it. We can do by following certain steps. My colleague Dr. Rutu Trivedi will talk more about practical steps to tackle social stigma.
Hello everyone, we are talking about the social stigma, basically the reaction that general population has towards the people with COVID-19 illness. What works is building trust in health services, showing empathy to those who are affected, understanding the disease itself, adopting effective and practical measures so the people can keep themselves and their loved ones safe. Stigma and fear often leads to prejudice against the people with illness, even amongst the service providers. This prejudice and discrimination leads to the feeling of hopelessness and shame for those who are struggling to cope with the situation, creating serious barrier in diagnosis and treatment. It is important to stop social stigma. Here are some tips to stop social stigma. Words matters. Do's and don'ts while talking about coronavirus COVID-19. Talk about new coronavirus COVID-19. The official name for disease was deliberately chosen to avoid the stigmatization. The word CO stands for corona. VI stands for virus and D stands for disease. 19 because the disease was emerged in 2019. That's how it is COVID-19. Avoid talking about location and ethnicity to the disease. This is not Wuhan virus or a Chinese virus or an Asian virus. Don't attach adjective to the virus like killer virus, dangerous virus, dreadful virus, etc. When talking about the disease coronavirus, the words and language may have negative impact on the people. They can spread existing negative stereotypes and assumptions about the diseases. They can also strengthen the false notions, association between the disease and other factors. They can create a widespread fear or dehumanize the people having this disease. This can drive people away from getting screened, tested and quarantined. Do talk about people with COVID-19. People who are being treated for COVID-19. People who are recovered from COVID-19. Discuss about the symptoms and treatment of COVID-19. Don't refer people with disease as COVID cases or victim of COVID-19.
Stay tuned. we are going to share more videos about how we all together can contribute in tackling this pandemic. Namaste.